Is AI safe to use in your practice? It's a question more and more practice managers and physicians are asking, because AI tools are showing up everywhere in healthcare. In the next few minutes, I'll walk you through what that means for your patient's privacy, in plain, everyday language. No legal jargon. Here's the first thing to understand. AI is probably already in your practice, often without anyone formally deciding to bring it in. It might be the assistant that books appointments or answers your phones. It might be an AI scribe that listens to a visit and drafts the note. It could be a chatbot answering patient questions on your website, or a feature quietly added to your billing or record software. And here's the key point. If patient information touches any of these, HIPAA still applies, exactly the same as it always has. Now the catch. Many practices see the words HIPAA compliant on a vendor's website and assume they're covered. But that label does not protect you. A vendor can build a tool that's capable of being used safely. That is not the same as your practice using it correctly. Compliance is about how your practice sets things up and uses them, not a sticker on a product. Think of it like a locked filing cabinet. Buying the lock isn't enough. You still have to use the key, decide who gets a copy, and keep the cabinet closed. So what does HIPAA actually ask of you? Stripped of the legal language, it comes down to 4 everyday responsibilities. First, keep patient information private. Only the right people should be able to see it. Second, control who has access. Limit it to those who truly need it for their job. Third, get the right agreements. Any outside company that handles your patient data must sign a contract taking legal responsibility for protecting it. And fourth, keep records and train your team every year, not just once. With AI, a vendor's promise to protect your data only counts if it's backed by that signed contract and set up correctly on your end. In my experience, the problems that get practices in trouble are rarely dramatic. They're simple, human, and completely preventable. The first is the free chatbot habit. A staff member pastes a patient's note into a free public AI tool to save a little time, and that information may now sit on someone else's servers. The second is the handshake vendor. A new app gets adopted without the signed contract that makes the vendor responsible. And the third is the everyone can see it setup. Tools left wide open, so any employee can view any patient's information, far beyond what their job requires. Telling staff to be careful doesn't prevent any of these. A real safeguard does. You might be thinking, can't I just handle this myself? You could try. But consider what you're up against. The rules are detailed and technical, and close enough doesn't satisfy an auditor. The technology keeps changing. Every new AI feature is a fresh question about patient data. And mistakes are expensive. A single breach can mean financial penalties, mandatory patient notifications, and lost trust that's hard to win back. You train to care for patients, not to track privacy law. This isn't a reason to avoid AI. It's a reason to get a knowledgeable partner before patient data is involved. That's where a compliance advisor earns their keep. A qualified professional turns a confusing obligation into a clear, manageable plan. They provide staff training, plain language sessions, so your whole team knows what's safe to do with patient data and what isn't. They run risk assessments, a clear-eyed review of where your patient information flows and where it could be exposed, with priorities to fix first. And they give you IT and technology guidance, straight recommendations on which tools and settings actually meet the rules and which to avoid. The goal is simple. Keep the time savings of AI while keeping your patients and your practice protected. Here's the bottom line. AI belongs in your practice with the right guardrails. Before patient information ever meets a new AI tool, get a professional set of eyes on it. Training, a risk assessment, and the right technology choices are far cheaper than a breach. If you'd like help making sure your practice is protected, I'd welcome the conversation. I'm John Paz. Thank you.